you are here on India Today, you always expect real experts, real wisdom, real information and real data. The reason why we've dedicated an entire edition of 5 Live today to the COVID crisis is because of what we learned 2.5 years ago when China obfuscated all facts. Now we do not trust China, and therefore we need to be doubly, triply, quadruply prepared for what could possibly happen as a spin-off effect of the COVID crisis that's happening there. And remember, one of the most prominent, credible faces during the entire COVID pandemic here in India was Dr. Randeep Guleria, who was at the time director of the prestigious All India Institute of Medical Sciences. He was one of the government's soldiers, as it were, in India's big and in many ways successful fight back against COVID. There have been issues that India needed to tide over, but in many ways India has stood up as a model for the rest of the world. Our health editor Sneha is with me as well. She and her team have been breaking every single story as far as COVID-19 is concerned, and that's the reason why India Today continues to be the most watched channel on this issue. Dr. Guleria, really good to see you in your in your post-retirement avatar, but you're back on the forefront of healthcare in India, and that's the reason why we welcome you onto India Today. We're going to go to Dr. Guleria in just a moment. Before that, here's a report that Sneha brings us today. 3 years on, the novel coronavirus, not novel anymore, is still alive, kicking and causing untold mayhem in the China that birthed the virus. It's seeing the worst crisis in 3 years. Neighbor India is not taking any chances. And today, our Health Bureau analyzes the situation with hard facts. Take a look.
The fear of a possible return of the coronavirus has now got India on a high alert mode. Health Minister Mansukh Mandaviya held a high-level meeting to assess the India situation vis-a-vis China and said that COVID is not over yet. The worry? The infectious BF.7 that has been in circulation in China and has surfaced in India as well.
BF.7, the variant that is causing shock waves in China, already exists in India. In fact, it was spotted as early as in the month of September this year, and 3 times in total. But what the government is focusing now is on bringing back the mask mandates in the country. States will be asked to do so, and also looking at an uptick on the precautionary dose.
India is not looking at imposition of restrictions, but has asked for going back to the basics.
आप जब क्राउडेड प्लेस में हैं, अंदर या बाहर, तो आप मास्क करिए, और जो व्यक्ति उम्र में बड़े हैं या को मोबिलिटीज हैं, उनको तो ये ज़्यादा इसका इस्तेमाल करना है.
Experts say that surfacing of new variants and infectious sublineages need closer monitoring and sequencing. India has been lax on this front. The Health Ministry has also written to states asking them to ramp up sequencing.
Genome sequencing, on the other hand, is to send these samples to a specialized research laboratory that will look at the genetic makeup of this virus. Thus, they will be able to tell if new mutations have come or if the existing variants have changed.
The Government of India is also now stressing on the need to improve the uptake of boosters, saying that the uptake of boosters is just about 28%, which actually is fairly dismal. Very recently, the Serum Institute of India also spoke about the fact that it had to discard many COVID-19 vaccine doses because there is just no demand.
Particularly जो हमारे citizens, senior citizens हैं, वो कोई छूट गए हैं precaution dose से, तो हमेशा की तरह जैसे हम पहले भी अपील करते थे कि उनका हमें ज़्यादा ख्याल करना है. सीनियर सिटीजन्स क्योंकि वल्नरेबल हैं और बीमारी वाले व्यक्ति वल्नरेबल ज़्यादा होते हैं.
What the actual virus currently circulating is, whether it is a previously confined ancestral virus or a Delta variant, or is it from the Omicron family of variants which are currently the dominant viruses in the world for COVID. Based on that, we'll have to judge what the likely dangers are to both to China and to the rest of the world.
While China's situation is different from India and the rest of the world, the China crisis shows us that this virus that has the potential to cripple the world is alive and kicking even 3 years after it first raised its ugly head. With Milan Sharma in New Delhi, Sneha Mordani for India Today.
Now, here are just 5 basic questions that every Indian is probably asking right now, and I'm going to try and answer them to the best of the information that we have so far. Remember, the one thing that COVID has taught us is that everything is evolving. Number one, does the China COVID surge threaten us here in India? It's possible infections could surge. Remember, already 2 cases of the BF7 variant that's crushing China have already been identified here in India. Number 2, what is the Indian government doing at this point of time? They're identifying new variants, asking for protocols to return at this point of time. Question number 3, could India see another COVID wave potentially? There is a possibility of this, because an increase in cases is almost definitely to be expected. Whether it becomes a wave is yet to be seen. Do you need to take another booster dose of your vaccine? Not yet, as far as the government is concerned. No specific instruction as far as an additional booster shot is concerned. And finally, question number 5, could restrictions or even a lockdown return to daily life? Mandatory mask, mandatory social distancing and things like that, only if severity of infections increase. I repeat, at this point of time, there is no reason to believe it will happen, but it's best to stay prepared, because we're dealing with a crisis in a country where we can't even depend on authentic information. Let's go straight to Dr. Randeep Guleria for our first question. Dr. Guleria, is a surge in India expected as well, given what we're seeing happening in China right now? There are already 2 cases of BF7 that have been identified here in India. Do you think there will be a surge in India as well, like it is in China, sir?
So like you rightly said, this sublineage of Omicron has already been seen in India in October, which is being reported from China. The situation in China and India is quite different. In China, because of the zero COVID policy, there is a large number of people in China who are sort of naive or are not being exposed to the virus. Also, the vaccine uptake in the elderly and high-risk group is low, and we don't know about the efficacy of the vaccine. The situation in India is different. We've had a good vaccine uptake, even our booster dose has been given, and we have data that the vaccine is effective against the new variants. Also, a lot of people have got natural infection, so there is also immunity because of natural infection. And because of the fact that our population is protected from all of this, the chances of the new variant causing a severe illness and more hospitalization or deaths in our country seems to be less likely. But having said that, we need to be more vigilant, because we know as cases increase in a particular area, the chances of mutation and new mutants coming up also becomes more. Therefore, good surveillance for any cluster of cases, any increased hospitalization in our country needs to be done, and very aggressive genome sequencing so that we pick up the variant early and are able to link it with any clinical or epidemiological change which we see in the pattern. Currently, India is in a good position, but I don't think we just need to rest. We need to be prepared for any situation which may arise.
Dr. Guleria, the Government of India held a high-level meeting today. Various things were discussed. What should the government do right now in terms of the kind of advice that goes out to people? What should be the next few steps in the next few days or weeks to come?
So I think, as has been already said by the government, there needs to be more of testing. We need to encourage people to come forward and get themselves tested. Many individuals who have classical COVID symptoms don't get themselves tested. So they should get themselves tested, because then only will we know if they're positive, and we can do genome sequencing if we have a proper sample. You can't do genome sequencing if you do the rapid antigen test. You need to do an RT-PCR test to be able to do genome sequencing. So people should come forward and get the RT-PCR test done. Also, we have to have surveillance, which is sentinel surveillance in hospitals. So if there is increase in hospital admissions or ICU admissions with flu-like symptoms or viral pneumonia, then that should be a red flag so that people know that there is something happening and genome sequencing of all these samples should be done. So sentinels surveillance may also be very useful. And I would say physicians and healthcare workers should be alert that if a cluster of cases happens in any part, then that should be immediately reported. Large-scale testing should be done there so that we're able to identify any new variant in that area, and we're able to link that with the clinical and epidemiological profile of what is happening there, and then take measures to control the spread.
You know, Dr. Guleria, most people, I would hazard to say, even as recently as yesterday, you know, were wondering whether they were ever going to see headlines or news about COVID ever again. And now there's blanket coverage, you know, led by Sneha's team of this COVID crisis here in India. And many people are wondering, the outbreak that's happened in China reminds us of something we never wanted to think of again. But many are now asking if there will be a replication here, sir.
Correct. So there are two parts of this. One is when the outbreak happened in China in December of 1919 and then went on to 2020 and then spread to Italy and subsequently to other parts of the world, we as a population had never been exposed to the coronavirus COVID-19, and therefore our immune system was not at all prepared or tuned to fight this infection. We have come a long way since from there. We are now in a better situation because of vaccination, because of previous immunity, due to the getting infection, and therefore our body is able to fight the infection better. But the virus also is clever. The virus develops immune escape mechanism and it's becoming more good at that, but it's causing more infection, but not severe infection. So we will see cases which will not go away. COVID is going to be here to stay, and we will continue to see infection, but that is quite all right if it's just a flu-like syndrome, rather than having severe pneumonia like we saw last year when the Delta variant was there. Currently, the Omicron lineage is a milder form, and the sublineages don't seem to be causing severe pneumonia, especially in those who have been vaccinated and protected because of previous infection. So unlike China, because of vaccination and previous infection, we are now having a good degree of immunity, both as a population or what we could call as herd immunity, and therefore the chances of us getting severe infection is less. Yes, we will have cases of COVID. There will be some who will require hospitalization and have severe illness, but that will be much lower than what we were seeing last year.
Dr. Guleria, everyone wants to know, I think that's the most commonly asked question is, what should we do? Should we now, from tomorrow onwards, just start wearing the mask? I mean, at the end of the day, the government has held this meeting after months together. Also, we have the upcoming festive season, so social distancing norms, should that be looked into right away?
So I would really say that those who are at high risk, the elderly and those who are having comorbidities, should be extra careful. I would still advise people to wear masks, because that's a good measure not only from COVID point of view, but from other viral infections, including influenza and tuberculosis. And in areas where air pollution is high, the mask also prevents or protects you against air pollution. So it's a good thing to do. And also I would say that if possible, try and avoid crowded places, especially during the winter months, because you tend to stay more indoor, and if the ventilation is not good enough, then a lot of viral infections tend to spread, and you can get influenza and COVID-19 because of that. So precautions during winter months are important, and we must continue with that, because prevention is always better than cure.
Now, the Indian public, Dr. Guleria, is going to be very upset hearing that from you, because, you know, like Sneha said, it's the festive season, it's Shadi season everywhere in the country. So, you know, I'm going to repeat that question. Are you saying that, you know, big gatherings should be avoided at this time?
So currently our situation is good. We are not seeing increased hospitalization or deaths. So I don't think that I would say that we should go back to what we were doing last year in terms of total ban in all these activities. But like I said, the high risk group, if possible, should avoid crowded places where chance of infection is high. And even if they go to these places, they should wear a mask, and hand washing should also be done. But a total ban on such activities, I don't think is warranted currently. We are not seeing that type of cases in our country. We need to be vigilant. We need to take precautions, but we don't need to have a panic situation.
Dr. Guleria, always a pleasure hearing a sober voice, full of information and advice from someone like you. It's good to see you back. I wish it were in better circumstances, but here we are on, the potential foothills of another COVID crisis here in India. We will not scare people here. We will only have people like Dr. Guleria and Sneha on here to give you the information that you need in a timely fashion. Dr. Guleria, a pleasure. Thank you very much for being with me. And Sneha, I was hoping that things like hand wash and quarantine and social distancing and masks were words that could have been cast out of our lexicon. Sadly, that is not the case, and we have only China to thank. Remember, Sneha and her team will continue to track the story very closely. We will bring you updates on a daily basis. That's a promise. That's it on 5 Live. Thanks so much for watching. If you like the video, do like, comment, share and subscribe.